So we are talking about the physiology of oral health. That's about mouth cavity. That's about the connection between the mouth and the body. And there's a lot of interconnections, as you already know, about all the areas we are working with. There's a lot of interconnections, a lot of interdependencies. And you see, here we have some conditions here, and I want you to understand actually that it's about the flow. Now, we have the flow of fluids that are essential for our body, normal functioning of our body. That's the flow of blood distributing the nutrients, distributing the oxygen to the cells. And we have a flow of lymph that is that's the work of immunity. That's how we're protecting from internal threats. And now we have also something called salivary flow and balance. And that's what we really want to work. And when it is impaired, we have a lot of different problems. Gingivitis, that's the inflammation of gums. Periodontitis, that's when the inflammation of the gums, it goes into the bone, and we have inflamed bone. And as you see here, there's a difference that's between the normal tooth and the tooth that is inflamed. We have inflammation here, and we have inflammation here. When we have inflammation in the nerves and in the cavities, and then we have a reducing the bone mass. Actually, the level of the bone is going down here. So that's the periodontitis. That's gingivitis. That's a periodontitis, and that's the problems with calcification of the bone. And so it's caries. That's also we need we have holes. We will go to dental procedures. Those are interconnected. And then we have tonsillitis. That's the inflammation of the lymph node. That's the first line of defense of our immunity. So our immunity is impaired. And we have oral dysbiosis, halitosis, that's bad breath. That's the bad balance between the bacteria, different bacteria. And we have yeast infection, candida overgrowth, tongue disorders, throat inflammation. That's something also about the flow of mucus, its speed and viscosity. We've been talking about that. Then we have different disorders of taste and smell. We have chewing disorders because of mouth breathing, very, very often. And we have also taste and smell disorders because of medical distortion from the pills. And we have some age-related problems that we can reverse. Jaws and mastication, geometry of chewing, the chewing quality, the time we are giving to the chewing. Then we have nerve inflammation, we have chronic pain, something called trigeminal nerve, and it's also connected with the eyes, and something with impaired balance. Actually, so all of those things are interconnected. And we are going to look at these pairs and see how they connect together, what causes and triggers are, and what strategies of normalization are. But what you were going to see, that the salivary flow, that what regulates actually both the digestion, that is the breathing is highly influential on the salivary flow. And the salivary flow affects digestion, very much because that's the first level where digesting enzymes work. That's also something about we have different kinds of enzymes that works on different stages, 5 different stages of digestion process. And these salivary enzymes and the something we call acid reflux, it's actually interconnected. Acid reflux, one of the cases, one of the causes of it, it's actually chronic hyperventilation. So the balance of acid in the in our we call it the gastric juice. So the balance of the acid in the gastric juice is connected with the breathing, is also connected with the way we are, how much time are we giving to the mastication, to the chewing procedure. Something with timing to do. That's the mental part. So, and we have salivary stones. And salivary stones, that's the deposits, calcium deposits under the tongue. And that's, they create the impaired salivary flow. They also create a lot of discomfort and pain. So it's blocked salivary ducts, and they are just as big problem as impaired lymph flow. So because lymph flow is very crucial for our immunity, and when we have blocked ducts of salivary glands, different places, very often under the tongue, then we really have also impairment of immunity, but from the side that we are not really used to think about. That's the salivary flow. We have several enzymes and hormones. We have something called ptyalin. A ptyalin, that's a digestion enzyme. And if we have some gastric juice that is coming up, that we call acid reflux, it really it disables this digestive hormone. And we are working with stopping acid reflux by stopping inflammation. So all of those things that are stopping inflammation and this chronic hyperventilation and nutrition, the real fat balance between fat and carbs and protein, are also connected with the quality of saliva, of the amount of digestive enzymes that are really working in the digestive tract. So when the salivary flow is impaired, there's also a problem with the damaged mucosal layer. And mucosal layer, as we know, also is impaired by mouth breathing very much. So it stops the the speed is very slow, and the viscosity of mucus is too big, so it doesn't really move. That's how we get throat inflammations too, because of build up of toxins, build up of bacteria, bacterial overgrowth, disbalance of bacteria, different places in the digestive tract. Then we have something called lysozyme, and lysozyme, that's an enzyme that is very crucial, that is in the saliva. And lysozyme, it lyses, it dissolves the lining, protective lining, the membrane lining of bacteria. So that's how it kills bacteria. That's the first line of immune defense. You remember we've been talking about that when we've been talking about impairment of breathing, the internal nose, how the saliva and mucus, how it moves. The mucus has the speed and viscosity, and we've been talking about that as first line of defense of the immune system. So saliva, that is the first line of defense. You have to understand it. And nutritionally, what causes the problems? We have, as we've been talking, we are overeating sugars, refined foods, that creates inflammation. Then we have imbalance of good fats, carb and protein in our that actually creates too much glucose in the blood. That we have too many bad oils in our system that impair our immune system, to polyunsaturated oils, especially the inflammatory foods like refined oils that are actually preventing micronutrients to come in through the cellular membrane, both proteins and water, so it's create dehydration too. And all of this creates chronic inflammatory response. And the part of it is a leaky gut and small intestine bacterial overgrowth. That's the symptoms of chronic inflammation in the gut. And what we are doing nutritionally, we're rehydrating the body by drinking small amounts of water during the day, connecting it with nose-only breathing. That's how we don't remove water from our system, actually. Then we create the right balance between fats, carbs, and protein. We are using low carb, high fat, with intermittent fasting, caloric restriction, and timing is very, very crucial. Timing of meals here. We've been talking a lot of times about that. Avoiding inflammatory foods. So that reestablish good work of salivary glands. Breathing, why doesn't it work? Why do we have chronic inflammation in the mouth? Why our immunity doesn't work? Because we are mouth breathing. That's the biggest problem. We have dysfunctional sleep, and we have chronic hyperventilation in the early morning hours. So snoring and apnea, that's our symptoms. And you have to remember that the flow of salivary flow is diminished, is actually almost disrupted during sleep. That's normal, and that's unfortunately that's the time where bacteria can catch up and can grow like explosively. And if we are breathing with open mouth, that creates much more imbalance, much more dryness in the mouth, bacterial imbalance. So we have to remember that working with nose-only breathing and sleep hacking, diminished breathing, and lying in the right way, having good air quality in our sleeping room, in the bedroom, that's very, very crucial. What we can do also, we can do, well, it's under breathing, but actually it should be under physical. I call it mouth-tongue exercise. That's different exercises to create better muscle structure of the tongue, of the root of the tongue, of the whole tongue, and in the mouth. And it's actually, there's a lot of scientific studies that show that it recreates normal salivary flow, and it gives you possibility to better mastication and to better, so we have better enzymes for our first line of digestion, which happens in the mouth. And we call it ptyalin. That's for digestion. So it's better production of ptyalin and better work of lysozymes that are conquering bacteria too. So the mental side, that's a chronic stress that creates the whole line like of symptoms. First hyperventilation, then mouth breathing, then the bacterial disbalance, then chronic inflammation, and then salivary flow stops. And we have problems in the mouth. That's also something about planning, something about understanding, prioritizing the timing of meals. So it's a lack of time to digest and to eat, to the procedure, it actually. And that's why do we have it? Because we lack physiological knowledge. That's exactly what we are having now. We are making the cross links between the conditions, causes, and strategies. And we have understanding that all of these triggers, they promote each other in this way towards conditions and diseases that you get according, well, to your situation and to your DNA. And when we are walking with strategies, so we want to go from conditions to actually working towards normalization. When we have awareness, when we have an understanding of physiological knowledge, that's the mental part, and that's how all the strategies, they actually help each other to get rid of the condition and diseases. And that requires really understanding how to build up a process and not just wait, but do very, very small steps, create the good results. Food addictions, that's what creates also a wrong balance in the mouth and inflammation. And food addictions, that's a lot about sugars, that's eating too much, over actually working, when we let the whole systems, the system of digestion to overwork. And that's when we eat too much, too many times during a day. That's food addictions. And also things like very sugary and refined foods. What we do here, we have to practically do active meditation during the day. We have to work with relaxation while eating, prioritizing meals. But what I want you to know, that actually, that's a very, very crucial thing. That's when we work with the active relaxation and we move from stress to relaxation, that actually creates that triggers the vagus nerve. And vagus nerve, that's one of the reactions that actually promotes salivary flow. That's one of the very, very crucial things here. So that's both mental and breathing. And you know our exercise, when we connect physical movement, breathing, and the mental side. That's trigger vagus nerve. Where do we have a black? Trigger the vagus nerve. We have to write it here. We just write it here. Vagus nerve. So that's a very, very crucial part of it. Immunity. Well, as we already know, all the problems, the many, many problems in immunity is because of a lymph blockage. And that's what promotes inflammation, which also promotes inflammation in the mouth and pushes towards these conditions. That creates backflow of toxins. And some of the problems with halitosis and tongue disorders, that's actually a backflow of toxins that is not moved by the lymph because the lymph ducts are blocked, and that creates backflow. That's we have oral dysbiosis. That's a part of it. A yeast infection, candida overgrowth, that's also part of it. Then we have small intestine bacterial overgrowth, leaky gut. Is all of the problems coming from lymph blockage and toxin backflow. Well, remove tonsils, tonsillectomy. And there were some studies, very interesting studies, that actually show that while tonsillectomy, removal of tonsils, creates some good effects in the first time, but actually creates side effects, very, very big side effects too. Because tonsils, that's the part of our lymphatic system, and that's the most visible part of it, because we can really feel the tonsils. But the tonsils are the first part of immunity, because it's here where the bacteria are normally coming in through the breathing, through the mouth when bacterial balance is wrong, and there's nothing to kill the pathogens with, and that's where the cells of immune systems are coming from. So that's the immune system cells that are produced here that are killing the bacteria in the mouth. So when we have removed tonsils, then we have very much impaired immunity. So acid reflux, we've been talking about that. Chronic inflammation is also very much connected to a lot of diseases, also cardiovascular diseases. You see, that's the oral health factors, and that's well, the collection of all of the problems. The problems goes from here down there. So when we have imbalance through breathing and eating, everything that's coming through the nose and through the mouth, if we have imbalance in the oral cavity, in the mouth, the inflammation proliferates downwards, and we have the heart, lungs, gut, vascular system, lymphatic system, muscles, nerves, skeleton, we have skin rashes. So because that's what I wanted to show here, that's normally the doctors a little bit disconnected. So when the doctors are working with dental care, for example, and all other doctors, they work here, this knowledge is not connected, and that's what we are trying to connect here, so you understand. So all the chronic inflammation symptoms that you have inside your body, what we call the chronic lifestyle disease, and we don't have cancer here, but we have to write cancer here. That's very, very crucial, because that's also part of chronic stress, mouth breathing, lymph blockage, toxin backflow, lack of physiological knowledge. So we don't know leaky gut, disbalance of nutritional disbalance, that also leads to cancer. That is very, very crucial to talk about when we're talking oral health, connection between mouth and body, and immunity, because that's how we work with chronic inflammation. So this immunity here, one of the very crucial things actually, it's something called oil pulling, and we're gonna make it. I'm gonna show you in the exercise how to do it. We can do it with coconut oil, with olive oil. We can mix essential oils like oregano and clove, just one little drop in it. What it does, it actually removes toxins. And there's lots of studies, scientific studies that are done that are showing that it stops inflammation very, very slowly. And it stops oral dysbiosis and throat inflammation and actually caries and gingivitis and periodontitis, tonsillitis, taste and smell disorders. Mastication, that's a special thing, because that we can only change by knowledge, mental thing, nutrition and physical. And nerve inflammation, the same thing. So oil pulling is a very, very crucial thing to remove every day, in the morning and in the evening, to remove toxins from the mouth. Tongue scraping, also very strong thing. It's not enough with toothbrushing. Tooth scraping, it goes deeper. Avoiding fluoride toothpaste, because it's also actually fluoride. It's a chemical that promotes inflammation. It's not good for our immunity. Using flossing, soft brush to not scrap the protective layer of the teeth. That's very crucial. So the last thing is physical. And what creates the inflammation? What creates the bad salivary flow? You remember, vagus nerve. That's the lack of vagus nerve stimulation. Why? Because we are not moving in the right way. There's no good structure. Wrong posture, that's a wrong posture, and that creates strong chronic tension in the muscles. And when we have chronic tension, the flow stops. Remember, chronic tension stops both blood flow, lymph flow, and salivary flow. And we are working with balance, re-establishing balance. So when the balance is impaired, we have conditions and disease. When we restore flow and balance, we're going towards normalization. So, jaw misalignment is also a problem. When we are masticating or chewing on one side, then we create, that's both insufficient chewing, insufficient mastication, insufficient creation of salivary enzymes, lysozyme, ptyalin. That's both bad for immunity and for digestion. So when we have imbalanced misalignment, and we have problems with sleep too when we have misaligned jaws, and we have also taste-smell disorders, because they are actually connected. When we are too much on one side, the taste buds that are on the other side of the tongue, they're very, very slowly dying out. So that creates a very strong imbalance in the smell. And when we are mouth breathing, remember, the smell receptors that are lying up there, they are not used, because they have to be used with the turbines, with the turbinates. And that is only possible when we are doing nose-only breathing. Nose-only breathing, nasal breathing only. So they also die off. So you don't, when we have age-related problems with taste and smell, we can actually reverse them by normal chewing, more chewing time, more alignment, the real, and there's actually some devices that are available to help with that. But also the understanding of timing of the meals. Remember the nutritional window. It helps a lot to reverse this kind of thing. So the last thing. So how do we work physically? We use massage. We use lymph drain. We use our three-dimensional multiple-purpose exercise. Remember, exercise when we're doing the movement, also with not only with the physical joints, but also with something we call virtual joints. And that promotes normal flow of saliva in the mouth. That also promote lymph drain, and both very, very light lymph drain massage, but also this movement. We learn relaxation in movement, because remember, when we have chronic tension, it promotes inflammation. Relaxation in movement and progressive active relaxation, that's very, very crucial, because you remember, when we are stimulating vagus nerve in movement, so it actually creates flow. And the flow is about, promoting flow. That's everything. That's have good effect on chronic stress, that good effect on lymph flow, on blood flow, on on stopping hyperventilation. And progressive active relaxation, that's the exercise where we are connecting breathing, mental side and unity, and physical. And it actually promotes digestion too. And remember to cooperate with your dentist. And this is very, very crucial, to find a good dentist that understands what you are working with. And that's a very, very crucial part of dental hygiene. We didn't use this word until now, but hygiene, that's the part of the mental understanding and prioritizing of the immunity by the way of physical work. And that's, that's some very, very concrete things we've been working with today. Understanding that the oral health promotes body health, lowering inflammation. We called it the mouth and the body are interconnected and interdependent. And please understand this and remember to implement these techniques. Implement oil pulling. See the difference. Tongue scraping. All of those things that we've been talking about. Remember, salivary flow is just as crucial as the flow of lymph for your immunity and the flow of blood for the normal oxygenation and supplementation with nutrients to all of your cells in your body.